Hi, good afternoon, everyone. Sorry, I'll try to make this short and sweet if possible. My name is Dr. Saiful Adniab bin Abdul Latif. I'm sorry to disappoint Nadia just now that I'm actually the last one, and hopefully last but not least in that case. I am the Honorary Secretary of the Malaysian Hospice and Palliative Care Council. I just wonder how many in the room have ever heard about palliative care. I hope some of you have. But the thing about it, the awareness within our public, the people, lay people in the public, is still quite low in terms of what palliative care is. There's a lot of taboo when we talk about palliative care, not just among lay people, but among healthcare workers as well. Something that we have to work with quite passionately about for the past many years that we've been around. Next slide. Yeah. So the structure of the talk today is I'll give you a little bit of an introduction about who we are. Then I'll also explain to you a little bit about the education programs that we've been having with healthcare workers all around the country, as well as publications that we've had to also help people understand more about palliative care, and some research opportunities before summarizing the talk today. So who we are is that we were founded in 1998, a while ago, but back then there were only about 10 hospices that were within our council. This day, we have 27 hospice members who are part of our council. They're all around Malaysia. Just to give an example, around Klang Valley area, we have Kasih Hospice Society, we have Faith, Hope and Love Hospice. There's also ACC Palliative Care that is called ASPAC. There's Hospice Klang, and there's Malaysian Association for Pediatric Palliative Care. That's just Klang Valley alone. We have Hospice Negeri Sembilan, Hospice Melaka, Hospice Johor Bahru, and so many others all around the country. And they work quite closely with palliative care units in the different hospitals that they are in those states to try and help patients in the community who might need palliative care. Of course, one might argue, is that just all cancer patients? Actually, we do look after a lot of patients who are non-cancer as well, but the bulk of the work is still cancer patients. Up to 70 to 80% of community referrals for palliative care are actually cancer patients. The remainder ones are mostly end-stage renal failure who are not suitable or unable to continue on dialysis, or other organ failures such as heart failure and liver failure. Next one. Yeah, so like I mentioned, we have 27 member hospices at the moment. There are some hospices who are not part of our council, but we work very closely with them as well, because we try to think of ourselves as a very big group of people who are trying to provide palliative care for the nation. When we talk about universal healthcare, all of us are very happy to talk about preventive. A lot of us are very happy to talk about treatment. A lot of us are very happy to talk about rehabilitative. But the mere mentioning of the word palliative, then everybody goes hiding into a different corner. And not just that, even when we talk about what we do in palliative care, when we talk about the usage of medications such as morphine, we go into a deeper corner. And when we go into talking about the fact that the disease has become to incurable state and how to support people, becomes a deeper corner and a taboo. So what we're trying to work with is to try and build a narrative around people, because the definition of palliative care that is coined by the World Health Organization doesn't put word death in it. It's actually an approach that improves the quality of life for people with life-limiting illnesses, and we try to do that with prevention of any symptoms as well as any related suffering that can be related to physical, psychosocial, as well as spiritual issues. And we don't just treat the patients, we treat the family members too. Because like we've mentioned just now, cancers do not just affect the patients, it affects the family members. It affects a lot of other domains that are around the patients. Yeah, next one. So this is just a video, but I think it doesn't play well, but it's okay, we'll go next. Yeah. So we've had some education programs throughout the years. Next one. Yep, so we have ECHO training, which is a monthly virtual training that we give that is open to any people. It can be healthcare workers, can be allied healthcare workers. It may not be very relevant to lay persons, but then again, it's open to anyone who wants to learn about palliative care. You can learn about it on how to register for this on our website. We have the Malaysian Hospice Council Congress every 2 years, and we invite distinguished speakers, international speakers, as well as local speakers to talk about palliative care, the research and evidence-based treatment, as well as intervention that can help patients with palliative care needs. We have other education programs as well, where we send our members, at least 2 of them, to go to Asia Pacific Hospice Network Conference that is held by different member countries every 2 years. And there are some courses run by our organizational members as well. These courses can be aimed at lay persons to learn how to become a caregiver for people with terminal illnesses. It can be educational courses as well to talk about how to treat, how to titrate medication either in the hospitals or in community, as well as awareness and fundraising program as well. As you may have noticed, we ourselves are an NGO. 27 of our hospice member organizations are all NGOs as well, and they all need fundraising from the public to maintain their services for the patients who need them. Next one. For the echo session that we've had, we've started running them since 2021, and we've had initially quite a lot of sessions because back then we had quite a low number of participants, and they were short sessions back then. And 47% of the people who participated feel like it was relevant to their practice, and the same percentage of people agreed that the topic were applicable and they feel supported in their role. Over time, we have even more people participating in the program, and we noticed that the number of people who agreed that the topics were relevant and whether it's applicable to their practice increases over time as well. So what we try to build there is we try to tell other healthcare workers as well, whether you work in palliative care unit or not, that you can also help with patients' care, whether you are part of an NGO in hospice societies, or if you are working in clinic kesihatan where you provide domiciliary care services, where some of them, at least 30% of them at the moment, have started also providing palliative care in the community for patients who need them. And part of the quote that was given is that the practical tips help to improve palliative care delivery for patients who need them. It's still a work in progress. We've got a long way to go, but hopefully we're getting there at some point. If you like to join our echo session, the first one is kicking out this March, and we're going to talk about wound care in palliative care setting. You can sign up, you can go to our website and have a look at it. Our National Congress is happening this year, all the way in Cebu, but we have invited international speakers, Dr. Frank Farris from American Society of Clinical Oncology, the medical director for palliative care as well as palliative care education program, will be giving plenary talk as well as workshops on communication prior to the Congress itself. We have also invited Dr. Raja Gopal from Pallium, India, and he has been a distinguished person over there who built up palliative care services for people in the poorer background to help deliver palliative care where it's needed the most to the people who needed them the most, and he'll be talking as well for our Congress happening this July. These are just some of the other local speakers that will be present there. Dr. Adnin Hamzah, the current chairman of Asia Pacific Hospice Network, as well as Dr. Richard Lim Boon Leong, the current head of service for palliative care services and the Ministry of Health will also be at the Congress later on. So some of the publications that we have published by the Malaysian Hospice and Palliative Care Council are, one is the Handbook of Palliative Medicine. We came up with the first one in 2015, and the current one just came out last year. You can actually buy them. They're written by local specialists to make it more relevant to the practice of palliative care in our setting and our country as well. We have published a chronicle telling people of the function of our council for the last 25 years and the activities of our member hospices as well. There are a lot of research opportunities that one can think about when you're dealing with people who need palliative care. And some of them include symptomatology and palliative care outcome measures, needs assessment and service delivery. A big paper came out last year by one of our board members, Dr. Richard Lim Boon Leong, and some of his colleagues as well, talking about how the Ministry of Health hospitals have a lot more coverage in terms of medications that is needed in palliative care setting, as well as the development of different units in multiple states. Almost all states now have palliative care units with specialists, and we're glad to say that in probably 4 to 5 years' time, we will have even multiple specialists in different hospitals. But we hope that the development that we have in the hospital at the moment will also trickle down to the community side as well. But for that to happen, we need a lot more involvement from other people, stakeholders on the community side, to have more awareness as well as collaboration on how to improve patient outcomes in the community. Of course, like we've mentioned, psychosocial impact of diseases and illnesses, caregiver burden is something that we need to think about, as well as awareness and acceptance of palliative care. And that's all. In summary, we are supporting a culture of education and knowledge. Further research opportunities are available within the field of palliative medicine. And we hope that by doing this, we can address the care gap in achieving universal healthcare for all. Thank you very much. There's a last slide on context in case you need them.